everybody, it's Beth. I'm going to run through all the hip muscles that Dr. C's been talking about on my Study Buddy Bones here. I'm going to be going off of this textbook that I had last semester. It's got some really awesome diagrams and lists and stuff. I will have this with me tomorrow if anybody wants to look at anything, take pictures of any of my diagrams. I'm also going to have this one with me tomorrow. This is the one that I think a couple of you guys already have. You told me about it. I rush ordered it, and it makes so much sense. He has been lecturing straight from this, and I'm going back and reading the whole chapters and getting the context, and things are clicking and making sense all over the place. So I've got a lot of dog-eared pages in here for where we've already gone. If you want to look stuff up with it, you know, I'll have it around and we can share. So I'm going to start off on bones here, going over the quads. And we went through a couple of the adductors as well. So I'm going to start with the sartorius. And it comes from the ASIS and goes down to the pes hamstring area. And I remember it because we have the sartorius starting at the ASIS, the rectus femoris at the AIIS, and I remember the sartorius starts higher. So we have the origin here, and it comes down to about here. So we know that because it's here, and if it moves, the origin and insertion are going to come closer together. So with that in mind, it will help you flex the hip. Got a hip problem. Needs a replacement. If anybody knows somebody to refer him to, let me know. And he can abduct as well. Now the sartorius, like most of the things in the anterior compartment of the thigh, femoral nerve, because they're all right by the femur. So that's sartorius. Next we have the rectus femoris, which starts at the AIS, comes down to the common insertion point, goes over the patella, down to the tibial tuberosity. The vastus lateralis does not cross the hip joint, and that goes from about here to here. Vastus medialis, about here to here. Now, with that said, they all, because they're coming from up here and crossing the knee joint, as they get closer, they're going to help extend the knee because they pass it and they all insert around here. So they're all going to extend the knee, but the rectus femoris, because it crosses two joints, because it starts above the hip and comes down, it will also help flex the hip like this. So these are all femoral nerve, and he keeps talking that that's the nerve root L2, L3, L4. I think that's probably going to be important for us to know. The other one that's more anterior that goes into the pes hamstring area is the gracilis, and that is one of the adductor group. It comes from about here, the pecten pubis, and goes down to the pes hamstring area. And because it's an adductor, all of the adductors share, for innervation, the obturator nerve. Because the adductors are all coming from about this area on the pubis, and normally coming about here, and they help bring it in. But they're all right by this hole here, that's the obturator foramen. So obturator foramen, obturator nerve, they're all close by each other. So that's the anterior side. Over here on the posterior, with the hamstrings, they're all coming from the ischial tuberosity, and they're all crossing the knee joint. So to start with, we'll go lateral to medial. The biceps femoris has two heads, and it's got two enervations. So it originates on the ish2, comes down to the fibular head for the long head, and then the short head is the most lateral. It starts on the shaft, joins in, and also comes in at the fibular head. Now, because it's got the two heads, it's also got two innervations. The medial head, the long head, is innervated by the tibial branch of the sciatic nerve, like the other two hamstrings. But the short head, because it's over here, that's got a different nerve. It's the common fibular nerve. So the short head is the closest one to the fibula, it's the fibular nerve. We've also got the semimembranosus and semitendinosus. They all start up here. Semimembranosus comes down, medial side comes in by the medial meniscus. Semitendinosus is the last of the three that go to the pes anserine, so it comes closer to here. And if you remember, when we're palpating each other, we've got the two cord-like tendons along here. The biceps femoris is the one we feel on the lateral side by the fibular head. The semitendinosus is the one that we feel back here, and then the membranosus is deep to it, and we can kind of palpate that on either side. So, aside from the short head of the biceps femoris over here, these are all innervated by the tibial nerve. It's a branch off of the sciatic. I've heard it both ways. That's pretty much what he's covered with us so far. I want to run over a couple other little ones. The popliteus that he's been talking about, on my diagram here you can kind of see it, and he talks about how that's involved with unlocking the knee joint during extension. And it really makes sense if you see it like this. So it starts on the lateral condyle here, goes to the medial side, so this is the origin, this is the insertion. When it's acting, the origin and insertion get closer to each other, right? So if we've flexed it, and if we internally rotate physiologically when we flex it, because of where it is, that's how it helps unlock it. As we extend it again, it helps externally rotate to unlock, and these two areas where my finger and thumb are come closer together. I can feel it when I do this. So you see here, it's scrunched when it's flexed because it's internally rotated. That's locked. That's the screw hole mechanism he keeps talking about. So if you extend it and you externally rotate, it gets closer. The other little one that he's talked about is the piriformis. And this is clinically important because of piriformis syndrome. He's mentioned that and talked about the trigger points. We've got the three gluteal muscles that kind of layer up right around here. I'm not going to go over those today. But the piriformis actually starts on this side of the sacrum, the anterior portion. So it's starting from about here, and it crosses on this side through the greater sciatic notch and goes to the greater trochanter. It's one of what's called the short external rotators at the hip. It's one of a group of 6 that help move it this way. But because of it crossing through the sciatic notch, guess what else goes through the sciatic notch? The sciatic nerve. So it either crosses, the nerve crosses either right next to it, or in some people, according to my professor, some people it goes through the muscle fibers. And those are the ones that are more likely to develop piriformis syndrome, because if that muscle gets tight, if this muscle here gets tight, it's either going to squeeze on the nerve, or if the nerve is inside it, it's going to scrunch in, put pressure, and cause sciatic pain down the back of the leg. So that is a quick overview of the hip muscles for the midterm.